Eire social services. It is unnecessary to stress the extent to which the social services, especially in the 26 county area, are unable to fulfill the needs of the people. This inability is largely the consequence of the chronic depressed state of the economy and associated secondary effects. For example, the high immigration rate gives rise to a population containing an unusually a high proportion of very young and very old people who are in receipt of public funds compared to people of earning age who contribute to them. Thus, if the government were to raise the social service level, the cost would fall more heavily on the shoulders of the earning population than in any other European country. Adverse comparisons are often made between 26 county and 6 county social services. The latter are at the British level and were established in their present form by the 1946 Labour government in the teeth of Tory unionist opposition. They are maintained at their present level in the 6 counties by drawing on Westminster funds. In fact, they constitute part of the subsidy paid by Westminster in order to perpetuate unionist rule. As in the case of agricultural subsidies, it will be possible for the 32 county Republican government to provide social services at as good a level as any other European country once the united economic system has begun to pay off by giving full employment, cutting the immigration rate, and raising the national income per head. Initially, it will be possible to introduce budgetary measures to lift the burden of poverty and ill health from those who are at present suffering most by the provision of improved health services, pensions, and benefits. The government revenue will be divided between capital projects and social benefits. The improvement of the latter will be related directly to the economic development program. The following structure will be aimed at. The unemployment benefit to be aimed at would be comparable to the basic living wage. Severe and exemplary penalties will be imposed for abuse of the unemployment benefit scheme. Pensions will be sufficient to provide a reasonable standard of living. Retirement age will be any time between 65 and 75 according to health, ability, and inclination. The pensions will be provided out of funds to which the state, the employer, and the employee have contributed, thus constituting three-way contributory pensions. In the case of self-employed people, the contribution will be paid by themselves and by the state. Special assistance will be given to handicapped people in order to supplement their earnings ability. Specialized educational and training facilities will be a state responsibility. Education of handicapped children in their appropriate center will be compulsory and provided free. Institutional care of the aged and infirm will be in the hands of professionally qualified people who will make a scientific study of the aging process with a view to alleviating its problems. Generic centers will be organized to help old people who are self-supporting and who live on their own. Trained staff being employed to visit them at intervals. In rural areas, this might well be part of the local health service. Health services, including medical care of all kinds, maternity services, hospitalization, and drugs, will be free. Nominal charges, however, will be payable for prescriptions for those who can afford to pay them. Old age pensioners, for example, will be automatically free of all charges. The various features of other national health systems will be studied, and there will be consultation with the medical profession at all stages. The manufacture and import of drugs will be under state control and in the hands of technically qualified people with adequate laboratory and information services available. Costs will be kept down by the banning of drug promotion campaigns and by buying in competitive foreign markets, thus avoiding the drug monopoly price structure. Administration costs will be kept down. Hospitalization will be under the administrative regions, which will be, as far as possible, self-supporting. The doctor's time will be saved by providing the maximum of technical and administrative assistance. The GP will remain the basic unit of the profession, but they will be encouraged to function in small cooperative groups, sharing administrative and technical services, and with rapid access to specialist services in the main regional centers. The basic salary will be on a capitation basis for each local GP unit. Special rates will apply in sparsely populated areas. This will be divided up among the participating doctors by agreement among themselves. Steps will be taken to develop rapidly the study of social and preventative medicine, with particular reference to the mental health problem. Planned steps will be taken to improve the quality of the mental hospitals and to augment and upgrade their staff. The aim of all legislation, economic and social, will be to reduce the adverse effects of social stress on people and to develop a sense of personal security. Existing arrangements whereby certain hospitals are run by religious orders will be safeguarded, and the hospitals integrated into the general system. Interchange of information and medical staff between the various denominational hospitals will be encouraged. A basic non-sectarian professional structure is compatible with the existence of hospitals run by religious orders. Voluntary and cooperative organizations will also be supported in their work. The nursing profession will be open to suitable candidates without payment of fees. They will be paid in accordance with similar grades in other employments.